effective communication. We don't communicate well. There is no effective communication between the two of us. So what we need is to improve and to have an effective communication where my message is being transferred to you, you are receiving my messages. Effective communication within a healthcare setting between the healthcare providers, as you are the nursing aide, the nurses, the doctors, patients, family, is very critically important because we are having a different role in communicating. So ineffective or not effective communication among healthcare workers is one of the leading causes of medical errors and patient harm. Just can you imagine if you communicated wrongly, if you are not effective in communication, so definitely at the end your patient get harmed. Your patient have a medical error. It will produce or result in medical harm. And we are dealing with the patient's lives. We are not dealing with just, paper. We are not dealing with just simple wood or materials or things. We are dealing lives of our patients. So effective communication means patients are safe, patients are not harmed, and we will reduce or we will not have any medical errors. You have to remember that. Effective communication, it causes ineffective or not effective communication. It brings out or causes medical errors and patient harm. So what are the purposes of an effective communication? Why do we practice, or why do we want to improve our effectiveness in communication? Number one, we are improving to be an effective. It should be with the verbal. It should be effective communication by verbal and or telephone communications among us, among caregivers, doctors, nurses, nursing aid, all those healthcare providers. So we will be effective in improving communication verbally and through the telephone. So to report critical results of diagnostic tests. So we are dealing with live patients, alive. Patients are alive here. So whatever we do with the patients, if it is ineffective or not effective, it causes or resulting in what? Medical errors, patient harm. So reporting critical results of diagnostic tests must have an effective communication, or you must communicate it effectively to ensure proper handover is implemented. Just imagine if you are already in a healthcare setting, if you are with your patients, now you are going to hand over. Handover means giving your patients or handing over your patients to another individual, the other receiving individual. Because I am leaving, the other one is going to stay. So I'm going to hand over my patients to her. So it should be a proper handover. Like for example, I want to leave, I will leave, but the medication of the patient should be given at 12 o'clock midnight. So I will effectively hand over to the receiving nurse or the receiving nursing assistant that the next dosage or the next medicine is to be given by 12 o'clock midnight. So it should be handed over. It should be effective communication or effective handover to prevent medical errors and protect patients from harm. The first and the foremost ultimate, our goal is to prevent medical error. And protect patient from harm. In doing so, we are also protecting ourselves. So keep ourselves safe also. So let us discuss what are the most common error-prone communication. When there is a not effective communication, error can occur. And what are these most common error? What are these errors that occurs during ineffective communication? Number one is when patient care orders, means to say the doctor's orders are not given verbally well. So they are not passed. They are not given, the message is not given clear. So, and those given also through the telephone. Sometimes your caregivers or the other healthcare provider will just call you to pass a message to you through the telephone, but you were not able to get it completely. So you will just ignore it. So what we will do is to get it clear, to get the message clear through the telephone and through the verbal. So reporting back of critical test results, like the laboratory, when they call, they are passing with you the message that these are the results of the, like for example, the hemoglobin of the patient, the red blood content of our blood. So the hemoglobin is too low. So when you receive the critical result, anything that is abnormal, anything that is below or higher than the normal, we called it critical. Okay? Critical in a sense that it might cause, um, might cause harm to the patient, or the patient is going to a serious condition. So you must know the normal reports of like the hemoglobin, the oxygen, the pulse results, the pulse rates, all of this, you must know the normal so that you will know the abnormal results of it. So when the reporting of the telephone message through the telephone message, if you will receive it, you must ensure that you will receive a correct result, that you will receive a correct telephone message, that you will receive a correct laboratory telephone reports. Inadequate handover or transmission of care. When your patients are supposed to go home for discharge, what you need to do is instruct patients effectively. What I mean to say is proper instruction is to be given to your patients. Like for example, you are asking the patient or instructing the patients to come back for the next appointment for a follow-up. You have to give the accurate or the exact date. You should not give any unclear instruction to your patients. You have to give a clear instruction. The patient is going home, so he will need or she will need a proper instruction from you. So when she comes back to the hospital, she will know what she can do, what she will do. Okay? So language problem is another common error. Why? Because now here we are working together with different culture, with different languages. We cannot understand each other but only one. As long as we understand English, we can communicate because we have different languages. Different, you speak in your language, I will speak in my language, but the common language that we need to follow is English. So we have to be proficient. We have to be knowing for what we are going to say verbally. Literacy and health literacy of patient is another problem. So we know most of our adult patients or those patients who are old enough, they can even speak English. Okay? So we have to communicate with them through gestures. We have to communicate with them with the language that they can adapt or the language that they can understand. So these are the most common error-prone communications. Poor discharge planning. When the patient is going for discharge and we are giving them unclear instruction, this is what I was talking to you about. You don't let your patient go with a wrong and poor instruction. Give them a clear instruction. Another one is culture barriers and misunderstandings. Misunderstandings and cultural barriers comes with cultural, not diversified places or the place that we work in. So there are cultural barriers we cannot understand, we don't respect each other, and we will have a misunderstanding after that. So we must be respectful of other cultures. And how to improve this communication? Number one, as we say, we have to communicate accurately with the medical orders and the test results. So whatever medical orders from the doctors and the test results that we are going to receive, we have to effectively communicate it. Number two, to improve this communication, we need to improve our handover communications. In a sense, like we need to give a proper handover. You just don't go away or you just don't leave your patients without giving a proper handover communication. Number three is discharge patients effectively. So when discharging patients, give them a proper instruction. Give them a proper instruction how to use or how to drink, how to take the medications, how to take the injections at home, how to come back for a scheduled appointment. So those are the patient's discharge instructions. Accommodate language and literacy needs. How do we accommodate language? So as I said, different languages are spoken by different nationalities. So we have to accommodate their literacy. We need to adapt. We need to know what is exactly, even if we don't know how to speak with their language, but we need to understand what they meant for those spoken languages. Overcome cultural barriers. In overcoming cultural barriers, this comes with the cultural diversity. We have to communicate openly. We have to respect their traditions. We have to respect their language. We have to respect their beliefs, their food, their everything. So in this way, we are going to have a cultural diversified community. Repeatedly, I'm just talking to you about like overcoming a cultural barrier through cultural diversity. Now we go with the communication process. In communication process, we have 5 elements. 5 elements means that includes or that contain in a communication process. What is a communication process? It is defined as the way we exchange messages with each other. It involves both sending and receiving messages. Okay? So sender, we have number one element. We have the sender. In communication, there must be a person who transmits a message. These are the sender. So sender, sending messages, it may be verbal, whatever we say. Orally is a verbal communication. We are sending messages by verbal communication. Non-verbal communication is messages that is sent without a word. So there is no word. And aside from the word that we are going to say, instead of the words, we are, showing our facial expression, gestures, nods when we say no or when we don't want, posture. like our patients, you will be observant. You will see our patients when they cannot say, they cannot talk. They will just, like stretch, means to say you can understand that these patients wanted to get up. So personal appearances, when the patients show that they are happy, you can pick it up that they are happy. When they are sad, you will know that they are sad. So messages is the number 2. In communication process, we have a sender and we have the messages. Messages are those information that the sender conveys. Messages are the information that we send across. Okay, so that is the messages. Number 3, we have a receiver. Receiver is a person who receives the message. So when we pass a message, we definitely sure that there is someone across, we pass a message. So in receiving messages, we have an effective listening. So the person next to us or the opposite person next to us must be a listener. She or he has to listen effectively. Number 2, through reading a body language. So they must see, you must see that the receiver, the other side of the receiving of your messages must have read your body language. The third is written communication. By written communication, we pass our message and the receiver receives it. So that is the written communication. Number 4, we have the feedback. Feedback is acknowledging the message and we are evaluating whether we receive it. We receive it clear or we ensure that the opposite person received the message. Okay, so that is the feedback. We want to get the feedback. We want to know the outcome. The last is the channel. The channel is a medium by which we send the message. We are sending the message through a channel. Channel means, like for example, in the SMS, through the email, through the written papers. Those are the channels that we use to send our messages. Okay, clear? So this is the communication process. And we have 5 elements. Remember the 5 elements in a communication process. The sender, the message, the receiver, the feedback, and the channel. Okay, so we have 5. So all of these reference that I have provided to you in our lesson for today came from International Patient Safety Goal. And this is the IPSG-2, which is the improved effective communication between carer and the caregiver. So this is in reference to the Joint Commission International or the JCIA of US. Okay? So the effective communication that we discussed this time came from International Patient Safety Goals to improve effective communication between carer and caregiver by the Joint Commission International or the JCI. Okay then, so this is the last of the topic that we have for our lesson for today. So we have the communication process. And how to have an effective communication process is to reduce medical errors and to protect our patient from harm. Those are the 2 purposes why we are going to give our best in effective communication. Okay, and we have 5 elements. And what are those elements? We have the sender,
message,
receiver,
okay,
receiver,
and channel,
feedback,
channel,
and
and
channel,
feedback.
and the
channel.
feedback. Correct. You are right. So these will make up an effective communication. Okay? So now, we have already discussed the 3 lessons. So I just want you to take a quiz.
Okay.
So get out your papers and your pen. On the paper, above or the top of your paper, you write a clear name. Okay? So write your clear name on top of your paper, and once you finish the whole quiz, that's the only time you send it. Take a good photograph
Wala na
and
signal.
send it to the group as what you did the last time. Okay, ready? Just hold a minute. I'm just looking for my quiz here.
Dali lang po.
Sakit ng dila eh. Bapaha Charlotte eh. Charlotte. Charlotte, oh.
Ano?
Hello.
Okay, so ready with our quiz? So, okay, ready? We are going to have a quiz with what we have learned today. Communication process, the Maslow's hierarchy of needs, and the cultural diversity. Ready? So once you answered completely, only the time you send it to the group. Okay, start now.
Wala ang meeting natin.